There you are. Hello, my name is Mark. I'm here with a great team of CASEMCQ, the Center for Access to Services in English. Yeah, it's a team, and it's a team of people that like helping people through activities, workshops, and talk about health, facilitating, making things easier for the English community. Have you added us? Have you liked us on Facebook? You should. And did you know we have a website? You should absolutely go and check it out. Today, I'm meeting with a friend of a friend. She's a pharmacist, and I was just curious to know what exactly does a pharmacist do and what can they do? Let's meet Jessica Bisson. Whoa! So I'm here with Jessica Bisson. Is that the right way to pronounce it?
I guess Bisson is fine, yeah?
I'm happy that you're taking time out to come and speak with us because my friend, which is your friend, told me that you were soon going to have a little baby.
Yes, in 2 weeks. Exciting news.
In 2 weeks. So I hope you'll have a good delivery and everything will go fine. So mum to be, you're a pharmacist in the Greater Mauricie area. Since when are you a pharmacist?
I've graduated in 2006, so it's been nearly 15 years now.
Do you still like it?
I know.
Time flies. Do you still like it? Do you still have the drive to go and work every day?
Yes, of course. Like you have to, because like so many like people to help and people needing you, so you need to be like every day showing up for your customer.
What motivated you to become a pharmacist or to study and then become a pharmacist?
There's many aspects. First, I've always been curious about biology, chemistry, and how everything like can apply to the human body. Also, because of the pedagogic side of a pharmacist. So I came from a family of teacher, like generations of teacher. So even though I'm not properly teaching in front of a class, like with a specified program, I have like to explain and to transmit information one-on-one with like dozens of customers every day on very different topics. So I like it.
Because that's also what pharmacists do.
Mhm.
Like we see you counting pills sometimes behind the counter.
Yeah, this part of transmitting information is like very important part of it, and I like it. And there's the fact that there's no routine, like no case is the same. It's you have no idea what your gig gonna be, so you need to be alert and to keep up to date all the time. So I really like this part as well. Like it's not boring to be in a pharmacy.
Yes, going to the pharmacy, I noticed there's a little line that says, if you have a question for the pharmacist, go on this line. What can people go and ask you?
Oh, like we are the first line for the healthcare system.
Do you think people go and see you sometimes before they go and see a doctor?
Often, yeah.
Oh,
Yeah, so like the type of question that we have, it's like very broad range. So it can be like very basic, like what's the difference with Tylenol and Advil, or it can be very complex, like since last month I experienced this side effect, but I'm taking 15 pills a day. Can you help me? So it's a very wide range of questions that we can have, because like we're available without appointment and we're like available every day. So they use us for lots of information.
do you work side by side with the doctors? Or what I mean is when they send you a prescription, do you then do a double check with what is my client already taking? Because can it hurt them if they take both these medications?
Yeah, we do it all the time. So it's not because it's written by a doctor that I'm going to fill the prescription exactly as it says,
Oh,
because we have like a checklist to do for every prescription. So we need first like to check the patient, like is it the right patient, because you can have like lots of this mismatch. We also have to check is it the right medication according to the guideline and what we want to treat. We need to check is it the right dosage according to what we want to treat, because it could be like different for ear infection to a throat infection for the same medication. It could be different. We need to check for kid, is it like with the weight, is it the right dosages, or with kidney impairment, we need to adjust. So all of that we need to take in consideration. We also have to check, like, for formulation, like, is the person able to swallow medication? Can it be crushed? Or can we have like a liquid available? Is it an injection? Is it like in the muscle, subcutaneous? Like, lots of things that we need to check before delivering the medication. And if we're not sure about something, if I'm not feeling comfortable, I'm going to need to call the doctor or send documentation to have extra information, to make sure that it's, or to do a suggestion about what I would recommend if I'm not fully comfortable with the prescription.
Is there some people that would refrain from asking questions? Because I think that could be an important point. If someone is at home, they have an ailment, they're hurting somewhere, but they don't want to disturb anyone because they're so nice. I'm thinking of one of my friends, which is a nice elder lady that I know, but she's so nice and she never wants to disturb anyone. What would you tell her? Would you tell her, come and see me?
Yeah, of course. Like, there's always like people being a bit shy and don't want to disturb, but like, there is no stupid question, and we need to take time. This is like our job. I'm there like all day to help people. So if you have any question, you should come and ask, and we're going to try to figure out the best outcome for the patient. So don't hesitate.
Being a pharmacist, school-wise, what does it take if someone says, I want to help people just like you? What do they have to do?
I've done a bachelor in pharmacy. It's 4-year university, but about 10 years ago, they changed it. And now it's a PharmD, so a master degree. Roughly, it's 1 extra year of school. And if you want to work in a hospital, we call it établissement de santé, you need to have also extra classes and trainings, like stage, in different department of an hospital. So it's a bit longer.
That blows my mind. And I can understand, because the body is such a complex machine. And if you want to help, you can't go wrong. I mean, it's not like a car. You change the brakes. I mean, you change something and it's not the right suspension. Okay, it's not going to go well, but you need to be really precise. So thank you for all these years of studying, and thank you for taking care of people.
Yeah, we need to be very cautious. Like, something can go wrong, and like, we can kill people. Like, it's serious job. So when I was talking about being alert and like keeping on top and on focus, that's what you do every day.
You need to be 100% focused. Is it true that as soon as the pharmacy counter is open, there has to be a pharmacist on site?
Yeah, it's a law in Quebec. For other country, I'm not so sure, but in Quebec, it's the law. So during the opening hour, you always have a pharmacist on site to supervise all the activity of the lab. Yeah.
So that means if I don't feel too good and the pharmacy is open, for sure, I can go and maybe ask you a quick question.
Yeah, you might need to wait a bit because sometimes stuff go a bit crazy in the pharmacy, but all the time, if you're ready to wait a bit, we can help you for sure.
They can ask you, but if they're kind of shy, isn't there a phone number they can phone if they have questions?
Yeah, they can call 811, so you can have answer from nurses, but they can also refer to the pharmacy because we're more specialized in medication than they are. But if you like, you can also call the pharmacy. You don't have to show up at the counter. You can by calling, and if we're busy, we're calling you back later during the day. So there's no issue with that.
Okay, Jessica, situation. My prescription is running out. My doctor is like up to here. You know, I know it'll take a long time before I go and see him. I really need my blood pressure medicine or something. I'm panicking a bit. What can I do?
You just go to your pharmacy, and we're going to ask you a couple of questions about when's the last time you saw your doctor, when is your next appointment, and if it's like a chronic condition, we're not going to let you down. We're going to extend the prescription by asking a question, like for your blood pressure, by example, how will it control? Because if it's bad, we might try to push you to see a doctor anyway. But if it's stable and your blood tests are good, Like there's no need, there's no rush for you to go and see your doctor. So we can extend the prescription for a couple of months, give you time to take your appointment. And we can also fax the request to your doctor. So sometimes it's easier for them to just find the paper. So we can do both for you.
Teamwork with a doctor. Good. You were talking about blood tests. Can you ask for blood tests?
Yeah, like if I fill a prescription, by example, from the doctor for high blood pressure, my responsibility as a pharmacist is like that the medication is the right indication, so that it's effective and that there's no side effect and that it's safe. So in a week or two, I'm probably going to call you asking if your blood pressure is on target. I will probably call you to know if you experience any side effect, like are you dizzy or stuff like that. And I also have to make sure that you're going to have a blood test to check if everything is okay, like there's no negative impact on your kidney. And if there's no blood test done, I'm going to prescribe it to you. So I can do that as well. So checking if the treatment works well and is safe. So this is my job.
Just to make sure that the whole machine works.
Yeah, because sometimes doctor can just prescribe it and forgot a bit about the follow-up. So we have a surveillance obligation as a pharmacist that if I give you something, I need to know that it's going to work and it's going to be safe. So this is my job. Like it's not just I give you the pill and see you next month or see you in a year. I have obligation to check that everything is okay for you.
But you know what? That's kind of reassuring knowing that even if the doctor prescribed it, there's somebody else checking to see, do I really need it? Is it the right thing for me?
We're here to catch everything that can slip through the system. So we're not perfect, but we try to catch some little mistake here and there to make sure everything is safe.
Jessica, I've got another idea. Let's say I'm going on a trip. I know I've got motion sickness or something like that. I don't want to go and see the doctor. I'm going to feel like I'm going to be taking someone else's place if I go and see a doctor just for motion sickness. Can you prescribe something or at least point to something that's on the shelf, or do you have something even better behind the counter for me?
Like we have a different role to do. I'm not always there to sell you medication, sell you drug. I can like first step giving like information about everything that's sorry, how you say that?
Pharmaceutical.
Non-pharmaceutical measure. So the goal is to avoid taking medication. So this is one area that we can do. I'm going to give you a couple of examples. So what is non-pharmaceutical, pharmaceutical, and what we need to refer to a doctor. So people can come for like a very mild condition. Let's say for constipation, I can just recommend increase the intake of water, fiber, and exercise more. For a woman who's pregnant with like a morning sickness, I can recommend, let's say, to avoid eating at bedtime, especially like fat food, greasy food, or have like plain cracker to eat early morning before getting out to bed. And for a traveler, I can give him tips about how to avoid mosquito bite if it's going into an endemic region with malaria. So all this, I'm not selling any drug. I'm just like giving information. But I can also prescribe some stuff. So I can prescribe some laxative. I can prescribe some anti-emetic like Gravol and Diclofenac for the pregnant woman. And I can sell some like mosquito repellent, malaria prevention pills for my traveler. And because our approach is like global, if I want, I can push a bit further and I can prescribe like if they need any vaccine like hepatitis or yellow fever or medication for tourista like hydration, Imodium, antibiotics. So depending of where he's going and what he's going to do, I can push it a bit further and give a bit more. So this is all the stuff we can do like for.
That's also another thing that's very, very nice and reassuring that you're thinking of the whole picture, the whole solution. When you were talking about drink more water and this and that, and if you need, I can sell you something, but there's also other solutions. So
Yeah.
you're really taking care of the person, a bit like you were saying before. Transposing information, giving out information is part of what makes you tick there.
Yeah, and like this is like some over-the-counter solution or stuff that doesn't need a doctor appointment, but we can also prescribe stuff like a condition that's been like assessed by a doctor in the previous year. We can also extend that. So people doesn't already always know, but if you have urine infection, yeast infection, cold sore, eczema, allergy, and you've already been assessed for that, the pharmacist is going to have a little chat with you. And depending of certain like boundaries and regulation, we can extend those prescriptions for you. We can also decide to initiate some treatment. Some women can come for contraception. I can start that for them. I can start, if they want to quit smoking, I can start a treatment for that. What else? If you have shingles, Lyme disease, there's a lot of different disease that we can treat that doesn't really require the doctor. So just ask us and discuss, and we'll see.
What will be the main difference between a pharmacist and a doctor? Apart from, I guess, pharmacists don't operate, doctors operate. But since the doctors also have to have the big picture, the general picture, and the pharmacist also needs to have the general picture, what's the big difference between one or the other?
I would say that the main thing is like diagnostic. We can do that.
Okay.
So this is like the doctor area, everything about the difference between, how can I say that? Like, because we're not allowed to do any like manipulation, any exam, like no touching, no palpation,
Okay.
no scan. So this is not our area. But with the Collège des médecins and Ordre des pharmaciens du Québec, we managed to find out some mild condition or some disease that doesn't require necessarily like a big diagnostic. So we know the red flag, like this, of course I won't prescribe, I'm going to send to the doctor, but this is the boundary I was talking about. So you need to know this is a red flag, I'm not going there. But if there's no red flag, I can ask some question and feel confident that I won't harm my patient.
Yeah.
So, and I always tell the patient, I'm going to call you like in 2 or 3 days, and this and this and this is not better. You're going to have to go and see your doctor. So it's like to go a bit faster, to avoid like a medical examination for no reason. So I can try to help, but I need to know my limits and when to refer to the doctor or to the emergency.
You're the first filter to see if they have to go really further. I guess.
Sorry, I was telling you, like with the very first line. So people come to us because we're available. We're there, no appointment. So if we can help, we can try to accelerate like this whole machine process, just to make it easier for everybody. But when I tell you no, this is like it's out of my expertise. Sometimes it happens. So you need to go and see a specialist, a doctor, and stuff like that.
Yeah. Even though you want to help, it's good to know your boundaries, saying, oh, I'm not going to step over that line. That's for somebody else to say.
I can refer to a doctor, to a nutritionist, to a physiotherapist, to a psychologist, because we all have our field of expertise, and sometimes it's just, it's not for me to help you. So I try, but sometimes I can't.
Jessica Bisson, I know you have a little super baby inside of your tummy that's coming soon. So let's take some rest, and I hope you'll have a super healthy baby. And thank you so much for taking time out to speak with me today.
Thank you very much. It was a pleasure. Bye-bye.